Russian doctors. Hey guys, it's Dr. Emer, and we are talking shop, but we are now doing a great treatment. This is actually one of my favorite resurfacing treatments called Fractional Radio Frequency, or NanoFractional. What that means is it's when pins touch the surface of the skin and cause the skin to get these little baby holes in them that heal over the next few days. But those holes deliver energy much deeper, so you get skin tightening, pore reduction, improvement in texture, color, and tone, and it's safe on darker skin types in those that have melasma or hyperpigmentation from sun or pigmentation from acne scars. The other thing it really helps is acne scars, which is great. And we posted a few videos recently on the use of this device, this one specifically called the Viva, and those that were following before, there's other radio frequency devices that are superficial, Skinfinity, Venus Viva, and then there's also microneedling radio frequency where you go deeper and use needles with this energy, and that's called intensive device. So here we are basically going over the surface of the skin in a controlled pattern, and each pulse we deliver, we touch the pins to the skin, and then it just delivers a little bit of energy. How does it feel, Erin?
It feels fine. You know, it feels even better on the fattier part of your face, like your cheeks.
Why? Do you feel like it's working, or what's the...
It just feels like a deep...
Yeah, it's a deeper
pulse,
stimulation, yeah.
Deep pulse, you feel a little sense of heat.
Well, that's good, because what's interesting about this device is if I just don't pulse this, and I touch, close your eyes. Do you feel this?
No.
See, she's numb, so she doesn't feel the pins. But when we pulse it, it goes so deep, even when it's just touching the surface and not puncturing the skin. So this device does do a lot of depth work, which is why you get tightening versus most laser treatments where you really don't get any tightening. You might get some contraction of the skin and some short-term with tightening, but you're not going to get lifting long-term like this would do for the crepiness of the skin. The other thing this won't do is deliver too much high inflammatory energy that would cause pigmentation to worsen. And for her, sometimes working outside, getting a lot of sun damage and sun stimulation, we really have to protect her skin, but also do things in the office that's not going to stimulate any worsening pigmentation. So this treatment, while it's creating these little channels in the skin, they're going to build collagen. They're also going to allow the products that we're going to put on right after this treatment to penetrate more into the skin. The second part we're going to do of this treatment is go more superficially with our erbium laser to just get her a light peel to help some of the pigmentation come off.
So how long?
I'm going to switch sides while you can talk. Turn.
You said you were going how extreme with the intenseness?
Well, this one's a moderate intensity, so this is what I would say after someone's done 2 or 3 is what we normally would do. And then with the erbium, we're going to go same thing, a little bit of a moderate. It's going to be like a 2 or 3 day type of peel.
That's what I was going to say. How long is the downtime? Like, what am I going to expect to look like?
You'll be for about, I would say, between 2 and 4 days. You'll be lightly red with little dots on the skin, and then those dots will slightly peel. Then by the 3rd to 4th day, you'll look a little pink, and that will resolve by the 4th to 5th day.
Will I have swelling?
Yeah, today you will, and tomorrow you will, because again, we're delivering heat, we're delivering energy into the skin, which is why part of our protocol includes LED therapy to decrease inflammation with light stim, and also using at-home masks that are in the fridge that you put on cold, also ibuprofen and Claritin. We'll go through that. It's good to take that at least daily or twice a day. You know, you could, just so you guys know, and this is not medical advice, so don't take this as medical advice, but allergy medicines over the counter actually can be taken up to 4 times a day. There's a lot of research on people that have hives and using allergy medicine more frequently than the daily dosage, and it won't harm you. So if you're swollen after a laser procedure or fillers, take it 2 or 3 times. Calm it down. You know, just like you can take Tylenol or ibuprofen a few times a day as long as you take it under the max dose. But for kids that have hives or adults that get, you know, this kind of red swollen faces when they go in hot showers and stuff like that, or you go on a trip and all of a sudden your face blows up for no reason, get stung by a bee, whatever.
Right.
you know.
I love how he's so smart.
So you can do that stuff. I'm a nerd.
He's so smart.
I'm a nerd.
But it's like you're the best at
I'm
everything.
a gym nerd. I work out and I study.
I know.
That's all I do.
And you have an awesome
Yesterday we worked, and I have a dachshund, which she's the cutest. Last night we worked about 12 to 14 hours, then I went to the gym.
After the 12.
Right after the
We have a couple questions, Doctor.
Yeah.
Will it break down the dermal fillers?
It will not. No lasers have ever been shown to break down dermal fillers.
And this can treat melasma, correct?
Yes, we're treating her pigmentation right now with this. This or in combination with Clear and Brilliant do very well. A lot of times I'll alternate the Clear and Brilliant with this, because the Clear and Brilliant will get a little more superficial and get more of the pigment but less of the tightening and the anti-aging. And then I'll go to this to get more tightening and anti-aging. We'll kind of alternate that for my melasma patients. But for her, since we're going to do erbium, she's getting both. She's getting the color, the surface, as well as the deep. All safe. And I did the clinical trials that got this FDA approved. And at the time, we didn't even know it would treat acne scars. And the results were phenomenal. Those were on our Instagram story yesterday. If you missed it, check the highlights out. But we have some great photos. You know, people just have to have patience. A lot of these treatments take a few treatments to see the outcome. I've had a couple bad reviews online, which I don't think is nice to do. I think you should talk to your doctor if you're upset about things. But a lot of it was because a person did one treatment and said they didn't see a result. The issue is this is ongoing therapy. I do laser every month. I do a peel every month, a facial every month. I do micro rolling at home twice a month on my skin. You got to do constant stimulation. If you go to the gym once a month and expect to be a bodybuilder in shape, it's not going to happen. It's the same thing with your skin. You got to be working your skin out every day. Candace, my esthetician, literally has the biggest regimen I've ever seen somebody do. At least 60 to 70 products she has, but every day she's doing some sort of mask,
But she
some
looks
sort of
amazing.
cleansing, and she looks great. But she has melasma, so she knows it's going to come and go. And she's doing treatment. So like when her melasma flared last week, what did she do? She went home and she did a brightening mask. And what happened 3 days later? It all lightened up. So that's what you do. You know, it's a part of a process. If you don't want to be a part of a process and you want to be one and done, then you go to a spa or somebody that doesn't do long-term care. But if you want to be a part of a process and really build and age gracefully, you go to a dermatologist that's experienced.
Yes, dermatologist.
You know, so as you can see, if you go real up close here, the pins, I'll show you the pins. There's a lot of different pins on here. They're blunt ended.
Ooh.
So they don't poke the skin, they just tap it. It's a little tap. It's like a little tap dance.
Do you go more significant on like where I have this scarring?
Yes, I'm doing acne scarring. We're in two passes right now. Same thing on your pores. These pores are a little deep for me. So we're going over those twice. With the acne scarring, we go a little bit twice on there. You can go a little stronger too, but since we're going to do the erbium, we don't need to. And those pins tap the skin, and then they push the energy below. Whereas with microneedling radio frequency, you punctured the skin, and then you push the energy below, which means you don't affect the surface as much. This is why texture and color do a little bit better with this than with the microneedling radio frequency.
This is good for rosacea too, correct?
UPS, actually, in our studies, we showed that it decreased it. Do this with aqua gold or with our finishing touch treatment, and you really will help the rosacea.
What is rosacea? My mom's
Gosh, that's one of the hardest. That's like the hidden city. It's like hard to. There's no answer. No one can ever find it. And no one even knows how to treat it. So what it is just an inflammation that occurs on some people's skin. Some is background, their genetics, more common in lighter skinned Caucasians. Sometimes it's due to hormones or steroid medications that people take. But in general, it's a lifelong therapy with vascular lasers, meaning we have to use lasers that just calm the inflammation down. Now, turn a little bit. I just want to do a little bit on the edge, because remember I said, what does it do secondarily to the skin, you guys?
lifts.
Tightens it, so we're going to go longer jawline, extra pass, get a nice tightening effect. How did I learn this? I just did it after 4 or 5 years, and people's skin started looking better and better and better. We'll even add little threads in here sometimes. We already have some filler in here, which is perfect, creating the structure. So she has the foundation on the house. Now we're just cleaning the house. That's what I always tell people.
I like that.
Yeah. Always go all the way back by the ear. Get the ear wrinkles, because everyone hates those as they age. The ear wrinkles start to happen. It's like getting fine wrinkles around your eyes. Okay, turn all the way to the other side. Let's do the same thing. Lift and tighten.
It oddly feels good. I don't know why.
It's because you're crazy.
I'm nuts.
Kidding.
I'm nuts.
Some people actually like this feeling. Most women are fine. It's the men that have the problem with it. I don't know what it is with the men, but they always cry when they're doing this treatment, no matter how much numbing you do. I have one guy that wants Percocet when he does it. It's unbelievable.
I knew one guy that needed to be put under.
What? For this?
No, to get his...
Oh, to get for teeth?
No, for
Filler?
hair removal on his back.
My God, that's crazy.
Yeah.
But you know, we do have a device called Pronox. I'll throw a little spiel out for those people. It's half oxygen, half nitrous. It works unbelievable to calm down immediate pain, and it's out of your system within 10 seconds. So you can use that for very quick things, you know. So this is Viva, you guys. This is a perfect Viva. And we're doing a couple passes, but we're going to go over with the erbium in a second that I'll show you. So what I always call this part is filling in the gaps. Come take a look. So what happens is any radio frequency treatment causes inflammation. That inflammation is a histamine response, your body's reaction to a swelling, to a RF heating. So we shouldn't see any independent squares, okay? When I look at her now, it looks like homogeneous redness. But you see how there's a little space right there and there? We want to hit it. That means not enough histamine was released in that area. It doesn't mean we didn't treat it, just means that it didn't get released enough. This is different than laser energy. Laser energy doesn't need this because it's basically like a flamethrower to the skin. This one, since it's actually stimulating the skin directly, we need to make sure the skin all gets activated evenly. So we're filling in the gaps. We're taking a look 4 minutes after the first pulses and double checking if every area was treated. And it looks like we pretty much have all overlaps, which is fantastic. We'll go a little closer to the eye, get some nice tightening under there. Okay, Viva under the eye, it's a little sensitive. So again, here's a little spot that we missed. Again, we'll go a little closer to her eye. Perfect. And RF energy doesn't require shields unless you go within the orbital rim. So we're all good. So that is perfect. Now, if you take a look up close on the forehead, you can always see the dots. Take a look at all those baby dots. Those are the NanoFractional tips that have delivered the energy. That is our entrance now into the skin. When we put topical products on her, they're going to penetrate through those dots. So now we need metal shields. And I need my eye shields too. We'll give you metal shields now, because we're going to go to the erbium.
We're going to end the live.
And we're going to end the live because we just finished